The following segment is sponsored by Optum Utah. Colorectal cancer is one of the most common and preventable forms of cancer, yet many people don't know the warning signs. Dr. Jeffery DeGrauw is here from Optum Utah to share what we need to know. Welcome to the show, Doctor.
Thank you for inviting me. I want to thank you for talk about colorectal cancer screening and prevention.
Yes.
So for screening for colorectal cancer, there are some warning signs, and those include progressive weight loss, abdominal pain and bloating, constipation, diarrhea, and bloody stools. But despite these warning signs, most people when they're diagnosed with colorectal cancer have no symptoms at all.
Wow. Okay, what is colorectal cancer? People aren't aware of just the definition.
So define colorectal cancer as cancer of the colon, which is also known as the large intestine, and the rectum, which is a conduit that connects the colon to the anus.
Okay, okay. What other warning signs would we have? And you say some don't have any.
Most people do not have any warning signs at all. But again, if you have warning signs, they're going to be weight loss, change in bowel habits, bloody bowel stools, diarrhea, constipation.
Okay, how common is this, doctor?
So colorectal cancer is the third most common cancer in the United States today.
Wow.
It is superseded by skin cancer and lung cancer, but it is the second leading cause of cancer death in the United States for both men and women.
Second leading in the U.S. for
Yes.
men and women. Who is most at risk with this?
So for men, lifelong expectancy is 1 in 24, and for women, it's 1 in 26. And so what I like to do is take a concept on this and say, if you had, say, 25,000 people in an area and you were watching them, you'd expect about 1,000 people to come down with colorectal cancer out of that population. Our screening will actually change it so we can eliminate 850 of those.
Wow, it's so important. Okay, speaking of screening, how young should we be when we get our first screening?
So prior to 2024, we were doing screening with the ages between 50 and 75 because of the increasing rise of colorectal cancer in that population between 45 and 50. We've now lowered it to 45. So we recommend screening. If you have a normal colonoscopy, it's every 10 years. If you have a risk factor, it's every 5 years.
Okay, okay, good to know. How can we reduce the risk of getting colon cancer? Can we do that?
Yeah, colon cancer risk can be very easily reduced. Number one is by screening. Colorectal screening. You can also watch your diet. So a good diet, high in fiber, fruit, vegetables, lowers your risk. Avoiding tobacco products completely. Limiting alcohol. Being physically active also helps. And then knowing what your personal risk is. Because there are family risk factors such as people who have colonic polyposis or Lynch syndrome, and there's other individuals who are higher risk for other reasons such as ulcerative colitis or Crohn's disease. All these are higher risk people.
Okay, we have about 30 seconds left. Is there anything else that you want to add? And thank you for that. I'm glad we can reduce it. Thank you for those tips.
So the key on colon cancer is get screened, no matter what you do. The procedure itself is a little bit uncomfortable in the prep, but once you get to the procedure, it's done very quickly. And then you can have peace of mind that you've done what you can for screening for colon cancer.
Absolutely. Thank you so much for being here. The information is at the bottom of your screen if you want more. Dr. DeGrauw, great to see you. Thanks so much.
Thank you very much.